This is, I think, probably our biggest turnout ever that I can remember. We've been doing this for almost 20 years. It's a unique experience, a unique opportunity where our team is able to thank you all for your contributions to the work that have helped us make Arkansas a better place. Let me start by recognizing our 4 sponsoring organizations that without their support, we would not be able to do what we do. We turn data into information to help decision makers make hopefully informed decisions, and sometimes that gets a little rough. But our sponsoring organizations give us support to advocate for what's right for the citizens of Arkansas. So Marcy Doder, I know, is here from Arkansas Children's Hospital in the back. Thank you. We have several Blue Cross Blue Shield representatives. Cal Kellogg is here, I know. I haven't seen Curtis Barnett yet from Blue Cross Blue Shield. Cal over here on the back and the left. Our health department is a long-term founding sponsor, and we've got several members of our health department here, so thank you all. And finally, UAMS, which is our administrative home that has given us the flexibility and the freedom to actually represent the interests of Arkansans, regardless of the risk that it may place on some of our sponsoring organizations. So thanks to UAMS. Stephanie, where are you? Cam wanted to be here, Cam Patterson, the chancellor, but the NIH director is in Northwest Arkansas, and the NIH director trumped the Arkansas Center for Health Improvement today. Let me also recognize some of our elected and appointed officials. We have Mayor Greg Reep, former legislator, Mayor Reep from Warren. We also have Pulaski County Judge Hyde. Judge Hyde, where are you now? Here we go. Thank you for being here. And we have the State Surgeon General, Kay Chandler. Kay, where are you? Here we go. Here we go. Kay, thank you for being here. You know, with all of you in this room, we have accomplished a lot over the past year since we've been together. You know, our role, our mission, it's in our statement, mission statement, is to be a catalyst to improve the health of Arkansans. I was a chemistry major in undergraduate. A catalyst is something that helps make change happen, but does not get burned up in the process. And so that's kind of an important piece. We would not do anything as a catalyst does not do anything with the efforts and the energy of many, many others. Our work is far from finished. This state has many opportunities, many collaborations, many challenges, and you know, some of those that we've been facing in the past are going to continue to be with us in the present. But we've got to continue working together. To highlight some of the work that we have done over the past year and to give a little bit of a vision into the future, I'd like to invite our Policy Director, Craig Wilson, to come share some comments with you. Thank you.
Thanks, Dr. Thompson. It is always a pleasure to be among colleagues and friends and smiling faces out there. That's wonderful. I hope you've had the opportunity tonight to take the time to see some of the work that we've done over the past year. I know that we're here to really honor a lifetime of work, but I really want to thank my policy team, as well as our data and analytics team, as well as the administrative staff for all the work that they've put into what you see here. We really have had a focus on maternal health, and you can see that in a lot of our infographics around the room. That has been, we have recognized over the last 2 years, or I guess 2 years ago, that would be, in fact, a focus. And that has come to fruition, and we have tried to put as much information into that conversation as possible. And I think that hopefully will play out with the policies that are considered in the upcoming legislative session. I also want to say that we have made it a point as part of these conversations, while the focus has been particularly on maternal mortality and on maternal health, to push that into the infant health conversation as well. There's been a lot of focus on maternal health, but there's a kid that comes along with that too. And so we really want to push all of the efforts of the legislature and the state agencies and all of our policymakers into that realm as well. One of the things that I want to acknowledge over the last year that we are beginning to close out, we've recognized public health emergency as associated with COVID. but there has been a much longer public health emergency associated with the opioid epidemic. And we have been focused on that as well through our naloxone project that has been funded for us to work with well over 30 hospitals across the state to get the life-saving drug naloxone into the hands of those who have overdosed and those who are at risk of overdose, along with their friends and family, at that critical time when they enter into the emergency room. We have distributed over 1,000 doses of naloxone through that program, and we hope that it has saved some lives. Some of the data that you see around the room is really powered by the Healthcare Transparency Initiative, which we administer along with our partners through the Arkansas Insurance Department. We now have more than 10 years of healthcare claims data through legislation that was passed in 2015 to really empower researchers and policymakers and state agencies to really assess the programs and the performance of healthcare across the state. And we hope to enable further research, particularly in the maternal and infant health space, through some different tools that we've developed over time, as well as moving from very static information into more manipulable visualizations to look at more granular information through a number of different dashboards that we've developed related to behavioral health generally, behavioral health as it relates to maternal health, some work that we've done with traffic safety and fatalities that we're going to put out over the next couple of months. And then one of the most interesting things that we've produced is a healthcare expenditures dashboard to look at differences in payments across the state in counties or by payer, and I think that's really going to drive a lot of conversation. As we near the legislative session, we want to look back. We've got 10 years of Medicaid expansion in our state through working with partnership with all of you to get that in place. I know that Medicaid will be a big topic of conversation in the legislative session, so we hope that you will join us in that conversation as well. And then finally, Dr. Thompson, as well as many of the ACHI staff, have led a planning grant with the National Science Foundation with partners in Mississippi and Louisiana focusing on the Delta. And we now have a proposal that is being considered for a $165 million implementation grant to focus on food access, food delivery, and healthcare access in the Delta region, and we think that is a very promising proposal. Again, thank you for being here tonight. It's always great to see smiling faces, and I'll turn it back over to Dr. Thompson.
I mentioned our sponsoring organizations. We also have a group, our Health Policy Advisory Board, made up of 21 individuals who we strive, although they self-nominate and decide who's on the board to look like Arkansans. We have good geographic representation. We have good ethnic and racial representation. We've got large employers. We've got small businesses. We've got specialists. We've got primary care providers. We've got healthcare systems, community health centers. I'm not quite yet to gender equity, but we're working on that to get that where we've got good representation there. If you're on our Health Policy Board, let me ask if you could raise your hand and let us recognize you for your commitments. These folks serve us. I failed to mention we have R's and we have D's on our policy board, so when we come up with a strategy, I know what the questions are going to be, and I know where the soft parts are going to get stung as we roll good programs out to improve the health of Arkansans. We have several of our members that have resigned or retired from our board. Ray Hanley, let me ask Ray to come forward. I think he's the only one here. We've got a gift for you, if you will, for over a decade's worth of service on our policy board. Ray, former Medicaid director, former DHS director, former head of AFMC. But want to give this to you for recognition of over a decade's worth of service. Others, Jamie Mayo, Marcus Osborne, Herb Sanderson, are not able to be with us tonight. I'd also ask for a recognition of one of our founding members, the loss of one of our founding members, Don Hollingsworth. Don was a founding member on our board, former lawyer and head of the Arkansas Bar Association, drafted the governance documents for our organization now almost 20 years ago. We lost him earlier this year. Now I'd like to ask Danielle Taylor, our Executive Director, to come and set the stage for our coming awards. Welcome.
Thank you, Dr. Thompson. And it's my pleasure to be here and talk to you tonight about our Tom Bruce Award. This is the time of year each year when we recognize those who have demonstrated the courageous leadership and sustained record as a catalyst for improving the health of all Arkansans that embody Dr. Tom Bruce's lifetime of service. ACHI's Health Policy Board established the Dr. Tom Bruce Arkansas Health Impact Award in honor of Dr. Bruce, a national leader in community health and a champion of rural health and health system improvement in our state. Dr. Bruce was Dean of the UAMS College of Medicine for a decade and a pioneer in the field of community-based public health. He was also the inaugural Dean of the College of Public Health at UAMS and Dean Pro Tem of the Clinton School of Public Service. Dr. Bruce is remembered for improving and expanding the College of Medicine and addressing the shortage of physicians in Arkansas's rural areas through the formation of the area health education centers. He and his wife, Dolores, also helped pave the way for the establishment of ACHI through a seed donation. Their generosity served to propel public health efforts to a new level in our state, and as a tribute to his life and work, our Health Policy Board honors an individual or individuals with the Tom Bruce Arkansas Health Impact Award. This year, the Health Policy Board has chosen to recognize two deserving individuals with this award. And I hand it over to Dr. Thompson for those awards.
So both of the individuals our policy board selected have committed a lifetime of service to the state of Arkansas. The first that the board wanted to recognize is Dr. Linda McGhee. The family physician in Northwest Arkansas that has trained most of, if not all of, the family physicians in that region. She's spent much of the past 5 decades preparing family physicians for that frontline service. She began that work here in Little Rock after graduating from UMS before joining the Family Medical Center and Department of Family and Preventive Medicine at UMS Northwest in Fayetteville. As I mentioned, she's trained hundreds of physicians. She became one of the first physicians in our state to champion care for those with human immunodeficiency virus, or HIV, at the height of the AIDS crisis, and helped establish the first HIV clinic in Arkansas. More recently, she has been on the front line in engaging the state's Marshallese population to ensure that they have appropriate access to high quality and meaningful care that is culturally competent and so much more. When asked to describe Dr. McGhee, one of her colleagues put it simply, Linda McGhee is family medicine. And so that is, I think, where we are now. Dr. McGhee, please join me here on the stage, if you would. And let me ask others to pay attention to a short video here on the projector.
Like many children coming out of high school, I had no idea where I'd land ultimately or what I would do, and I still don't. I take the path that's offered to me, that presents to me, and that's always worked.
Dr. Linda McGhee is a force. She's brilliant, a philosopher, a doctor of profound knowledge, compassion, empathy.
Linda has been with the program up here in Northwest Arkansas almost from its inception.
She was very important to all of us residents at that time because it was sometimes in the middle of the night and you had a critical patient care situation, and she was always available, and seems like she always knew the answer.
She was more of like not just a teacher, but a mentor, and she always was very intellectually generous. And by that I mean she afforded me opportunities to grow in my career.
Well, I was taught by some great mentors how to be a mentor. My first mentor, probably most influential, was Joycelyn Elders. Joe Bates was another one. I've had some great mentors, and I've always felt it was my role to be a mentor.
She makes our residents be better caretakers, be better providers, addressing not just the health needs of the patients, but addressing all the social determinants of health.
She has a good heart, and she does care a lot for our residents and our faculty and the people that she takes care of.
Linda's one of those people who has the moral authority of a mother, okay? You know when they say something that they have no secondary gain in it.
She's one of those strict mamas that's going to keep you in line, in order to turn out the best that you can. She's not going to be the warm, fuzzy, nurturing kind.
In medicine, you're either a generalist or you're not a generalist. And so I've always wanted to stay as broad as possible so I could fill in where there's a need. And I think that's the way we need to be educating family physicians. It's as broad as possible. So that's what we do up here in our residency program.
She's a person with great compassion, unbelievable courage. She never was afraid of anybody.
Linda McGhee has never met a social issue she didn't like. I mean, that's clear, okay? She was involved with the creation of the clinics, and oftentimes she would man them by herself.
All my career, I've always worked with public health in some way or another. To me, that's what medicine is. Being part of your community, what your community needs.
If there was an issue that needed to be dealt with, Linda was the one you could count on her being there.
When HIV showed up in Arkansas, and none of us knew anything about it, but she saw the need and jumped right in and took care of HIV patients, has continued to do so in Northwest Arkansas, early on when nobody else would.
So she does this Tuesday evening clinic at Community Clinic in Springdale, where basically is geared towards Marshallese and other Hispanics, those from marginalized community that can come and see her, and she works quite closely with them. And that's on top of everything else that she does.
She's always been of her time, ahead of her time.
She's a sponge. I mean, she constantly is learning new things to try to help populations in need.
She goes from A to F in one step, whereas many people go A, B, C, D, E, F. No, she's already at F. She's figured it out.
I like to go deeper on understanding things, I think, and understand the basis of something and why we are doing it, and understand the why.
When you ask Linda what it's like to be a woman practicing medicine, and she says, I'm not a woman practicing medicine. I'm a doctor practicing medicine.
She's family medicine. I guess that's how would I describe Dr. McGhee.
I've never spent much time thinking about career. And I think that keeps you focused on the mission. And so I think when you go in that direction, sometimes you lose your focus. So I'd say stay focused on the mission.
She's a workaholic, but she knows how to find that balance.
I have fun every day, I do have fun working. I really love it.
Besides being a teacher, a mentor, she's also a dear friend.
She's what you see is what you get, and what you get is a lot.
Dr. McGhee, on behalf of the Arkansas Center for Health Improvement's Health Policy Board, I want to congratulate you on being a 2024 winner of the Dr. Tom Bruce Arkansas Health Impact Award.
Well, I just want to first of all, I want to thank everybody in this room for helping with this party and coming. Thank you. And I just appreciate this so much. I'm humbled by this award. To me, it's something that that doctors do, what I've done. I've had a lot of fun doing it. I just hope to inspire younger doctors, continue to do that. And I want to especially thank my family for coming. I have my family here with me and my better half. And they've always supported me. And I just want everybody to know that the best person, the smartest person in my family is here tonight, and I'm so pleased. And that's my 95-year-old Aunt Helen. And I would probably not be a doctor today if it hadn't been for Aunt Helen. I think I always believed in education, and so we have a family of people with graduate degrees. But Aunt Helen's degree is in high school, and she's the smartest one in the family. I just want everybody to know that. Okay. Now, I want to thank my mentors. I was so blessed to have been associated with people like Joycelyn Elders and Joe Bates, Dr. Abernathy, Dr. Ackerman, some of the great ones. Some of you guys will remember them. Were all inspiring to me when I was going along. Dr. Bose, Dr. Harold Hedges, Dr. Jim Patrick. There were many, many great mentors that helped me. And so that gives me the focus to continue to help all these other young physicians as they progress. And I've really enjoyed being employed by UAMS and by AHEC, Area Health Education Centers, and be given the opportunity to do some of these things. And so I'm just grateful tonight. I'm very grateful. And thank you all for coming. Thank you.
Many of you know our second recipient very well and have worked closely alongside him. Dr. Rick Smith has had an immeasurable impact on the state of Arkansas. Our policy board debated. We usually don't give an active board member an award, but we thought this might secure his retirement if he actually got a Lifetime Achievement Award that would keep him from coming back. He was an early champion of health services research and its potential impact on policy. He is one of the founding reasons that the Arkansas Center for Health Improvement exists. He served as Dean of the College of Medicine not once, but twice. Along the way, he's led by his example to be a better physician, a better leader, and a better person, affecting many across the state that he never touched directly. He's done so much for our state, it's impossible to stand here and try to summarize it all. Instead, let me ask you to watch a short video of individuals relaying Rick's accomplishments.
You know, I was drawn into psychiatry and public health. Got the public health merit badge when I was a Boy Scout in Jonesboro, Arkansas. And that was interesting and scientific behind it and fascinating.
I think Rick's impact on public health in Arkansas is immeasurable.
He's not just a nice guy, but he's a knowledgeable guy. And he has a way of seeing the forest from about 30,000 feet.
He's the kind of professional physician that works behind the scenes. He doesn't need the glory, and he's willing to put in the hard work, but he has literally changed the landscape of Arkansas.
It's like this is his hobby. This is his extracurricular activity, is public health. And it's a beautiful thing to watch, and a fascinating number of people that have surrounded him.
He was just a lot of energy, and it was all dedicated to health and the state of Arkansas.
There's no doubt that from a public health perspective, he's made so much difference because, you know, he kind of lives the UAMS mission. Our mission is to improve health and health care throughout our state. That's his DNA.
You know, I've watched Rick as the College of Medicine Dean now twice, as the head of the Psychiatric Research Institute, the head of the Psychiatry Department, the head of a Mental Health Services Research Center, and the head of the Arkansas Center for Health Improvement. You know, I think he is at his base a committed citizen of Arkansas. He uses the tools of health services research, advocacy, leadership to make a difference, and he instills those characteristics in others around him, encouraging them to move forward in step and quickly.
He's got all sorts of balls in the air, and I never saw one come crashing down. I saw some close, but I saw him pick it up real quick.
The Psychiatric Research Institute that Rick opened, we hospitalized, took care of about 1,500 patients a year. We were busy, and at times it felt like we were building an airplane like as we were flying.
Dr. Smith is such a visionary, and he had the vision for education, for research, and for clinical care, all at the same time. And one thing I love about Dr. Smith is he brought others along, and he has really worked hard to move the needle in psychiatry.
We got the idea to do this, and if you stay at it long enough and you're fortunate enough to live long enough, you can usually get something like that done.
One day we were visiting, and I said, you know, every time I talk to you, I feel like you're diagnosing me. And he said, I did that the first day we met. It's your easy diagnosis. And I've been treating you since then. So.
He's very persuasive, and he could persuade people to do things, and he would help them. It's not like he just, you know, threw them overboard to swim.
If he wants to recruit you, beware. He is very, very good at recruitment.
Dr. Smith, along with other visionary leaders, Joe Bates, Tom Bruce, and many others, had tried to get a College of Public Health started unsuccessfully. The consolation prize was the initiation of the Arkansas Center for Health Improvement. Kate Stewart, Suzanne McCarthy, Rick had started that, and I was in DC. Rick came up and said, it's time for you to come home and help us.
Yeah, I talked Joe Thompson into coming back to Little Rock, and I remember sitting in Washington, D.C. in a restaurant several times and saying, you know, we need you back here.
When he goes after something, he goes after it.
Rick set the Arkansas Center for Health Improvement up to take risks that the sponsoring organizations would not take. And occasionally he got nervous with some of the risks that we were pushing out in front. But he never said stop. He always said, if it's the right thing, if it's going to make a difference, if we can have an impact, let's go for it. And the Arkansas Center for Health Improvement has that imprint to this day.
He was very involved in the tobacco settlement. I think the vision that he and probably others shared was that those settlement dollars really needed to be invested in health and well-being.
We were working hard. It took 2 years to sell the program to the legislature.
I bet we took 30 or 40 bus trips around the state to convince people in various towns that this is a good idea for them and it's important to their community.
He sees the big picture. You know, and I think the tobacco settlement was something he saw as an opportunity to really impact the general health of Arkansans.
You know, it's really fun to be married to a man that is that talented and that loves what he does.
I mean, look how many times he's been called back to UAMS.
You know, he keeps retiring, coming back, retiring, coming back.
I mean, I keep thinking, retire.
He came right off the bench to come back in and help the institution that he loves and the state that he loves. And I don't understand why anybody wants that job, much less want it twice.
He's given his life to UAMS.
He has a North Star that is always going to make a difference for everyone, not just those that are immediately around him, but those that he'll never see and will never know.
I've been very thankful for all the people that I've been able to work with, not just mentors, but colleagues and peers and people that I've talked into doing things. It's been great.
He's somebody who may retire from getting a paycheck, but he's never going to retire from making our state better.
Rick, in the 26th year of ACHI's existence, and on behalf of the Arkansas Center for Health Improvement's Health Policy Board, I want to congratulate you on being the 2024 winner of the Dr. Tom Bruce Arkansas Health Impact Award.
Rick, please join me up here.
Wow, that was quite a video. I'm fortunate to have friends who are easy with the facts and not too critical. Thank you to all of you who participated and who put that video together. I'm grateful to the Arkansas Health Policy Board, or the Arkansas Center for Health Improvements Health Policy Board, for the honor of receiving the Tom Bruce Award. It's a distinct honor and one that I will cherish. I think the reason that they gave me the award was that I was so close to breaking Tom's record of the number of retirements and returning to work as a dean. And I suspect this was not so subtle encouragement, as Joe said, to finally hang it up and let others do the job. For those of you that did not know Tom or know his legacy, Tom was a true force for health in his home state of Arkansas and internationally as well. Tom, as was said earlier, was one of the first leaders to address the issue of rural health in Arkansas, culminating in the first book that I know on the subject, published in the early 1980s. Tom was also a key thinker for us as we developed ACHI. And as Joe said, he and his wife Dolores were the first philanthropists to support ACHI in the early days, along with the generous support of the Winthrop Rockefeller Charitable Trust. Of course, I want to thank my family who suffered through the 50 years of my wild ideas and excessive hours that went into these and many other not so successful endeavors that you did not hear about tonight. I want to thank all my partners in crime who were willing to take a chance and cast their lot, energy, and good names to help make so much of this happen. Thanks to all of you, most of whom are either in this room or in the great ACHI reception in the beyond. I finally have a plea for you, and one I hope you will take to the many others in your areas of influence. In this hyper-partisan period in our state and nation, I want to urge all of us that health improvement can only be realistically accomplished for a state such as ours in a nonpartisan manner. All sides must pull together to get these hard, almost insurmountable tasks done. I believe that the people in this room and their close allies can and will accomplish great things for the health of the people of our state. Thank you.
Thank you, Rick and Dr. McGhee, for your lifelong commitments to this state and to your professional efforts and personal relationships. I want to just draw us to a conclusion and give you a few short comments. Your Center for Health Improvement is very strong. We've got an incredible team of data architects and managers, analysts, policy experts, infrastructure in place. We have made impact over the 26 years that we have been in existence. We've had successes much of the time. We've blocked some things some of the time, and we have a lot of work to do. Craig mentioned some of that we've worked on in the last year. Moving forward, we'll continue to try to optimize the data assets that we have. We're putting out a data set on maternal and child linkages to get the maternal and infant health mortality that are so critically important for our state to address. We're doing a diabetes-specific data asset that we'll put out to try to help undergraduates and master's level students get comfortable analyzing the data. Tomorrow we engage with the superintendents on an increasingly recognized negative impact of social media on the mental health, particularly of our youth and of our young girls. We have workforce issues, not just physicians, but nurses, pharmacists, allied health professions throughout the system that we are fully engaged on looking at the licensure pathways and educational pathways for those. And finally, we continue to look for every opportunity to reduce avoidable burden of disease through tobacco, through health habits that rob our citizens of the quality of life that they have. So your center is committed. We are excited to have this appreciation event because without you, we would accomplish nothing. So please enjoy the rest of the evening. Congratulations to our recipients and help us make 2024 and 2025 a year to remember. Thank you for being here tonight.